Bonding dentists together at Dentist Job Connect is what we love to do to help associates find amazing associate positions and practice owners unlock more freedom, fuel practice growth, and best of all, fewer hygiene checks. To connect with us and see all of our open positions, text HIRE to 215-798-9897 or reach out to us at dentistjobconnect.com. My name is Paul Dr. Nacho Goodman, founder of Dental Nachos and Dentist Job Connect. I have these jobs because my original dream of playing professional basketball failed. You grow to this size, you have this speed, you got to get new dreams. My guests have heard that before, but I love connecting dentists to help them learn, laugh, and feel less alone. So I want to welcome my guests on today. Would you share? We'll start with Kimbra, who you are and what you help dentists do.
Hi, I'm Kimbra, and I help the dentist in our practice. I don't know how often I help most dentists, but I help dentists just become, I think they know the dentistry, but I help them become, I'm hoping, better leaders and better teammates, and just kind of have a perspective of our office that they don't, so I can give them a little insight that maybe they wouldn't have otherwise.
I'm so surprised, Kimber, because I'm a dentist. I know we're going to talk with you're awesome dentist, but in dental school, we had all those great classes on leadership and managing. Just kidding. We had none of it. We memorized the Krebs cycle 57 times. That's helped me 0 times, but it would have been nice to have some of those classes. So thanks for being here today, Kimbra. And our next guest.
Oh, that'd be me.
That's you, Dr.
That'd be me. Hi, I'm Tim Huckabee, and I'm the founder of Huckabee Dental. And we've been in South Lake, Texas for quite a bit. In the location we're currently at was opened in '97. We have 6,000 square feet, 4 general dentists and an oral surgeon. So we're a larger practice. And we are looking for someone who wants to come and be a forever team member. We're really big into long-term relationships. We have many team members that have been with us over 20 years, over 15 years, over 10 years. And we're looking for that kind of person that wants to come to a place that's well-run, ethical, and have a career. And that's what we're looking for.
I love that. I also share one of my themes is to help dentists cry less and smile more. And you're both DSI members, and I love seeing you at events. And you help me cry less and smile more. So I just want to share, as much as I love Facebook and all these connections, I love when we get to hang out in person with Dr. Mark Costas and his team. So I appreciate you guys helping me as well. So let's dig into the details. You talk to dentists. We need details inside of the details. We want to know what the probing depth is on number 15 distal and work on number 30. Why? We don't know. We got messed up in dental school. So let's dig into the details of this position. We'll talk a little bit more about your practice, but just Kimbra, give me, or Dr. Tim, some of the details here that we see on this image.
I'll let Kimbra go first because as the COO, she is responsible for the day-to-day management of the practice. Thank goodness, not me. And she often knows the details better than I do.
Awesome. All right, Kimbra, share with us some of these details.
Yeah, so we're looking for a full-time associate, and we're looking for 4 days a week and flexible scheduling options with that, as it says here. But there will be a daily guarantee. I can tell you guys that with any associate that we have brought on, they usually will get 30% of production, and that is off of production and not collection. So that's big as well, and very generous of Dr. Huckabee to do so. But when we're paying that out, I've yet to really have an associate, because we have such a supportive team around them, that has had to take that daily guarantee. So we're always hitting our goals over that majority of the time. And again,
awesome.
Good to see it. So that's an awesome thing. Again, we're in a beautiful area in Dallas, Fort Worth, and it's close to the airport. So it's just a great, and then we also, you can get to our practice from Dallas as well if you want to be in a kind of more younger area or just more happening area, I guess. But South Lake is a great area to be. We're looking for someone that has 2 to 3 years of experience, that can also lead. We have an incredible team that supports one another in so many ways, and we have an incredible doctor team that they are the best leaders, but they are also not afraid to be led, and that also makes them such a great teammate. And that's what we're looking for in our practices. Someone to, again, we've already got it down. We want someone to come in and again, just roll right on with us and just row in the same direction we're rowing in.
I love that example. I love that mission. Was at a DSI event where I shared it's about the three M's for associate dentists: mentorship, money, and morale. And it's balancing all of those things. I think it's awesome that you create this balance. There's other dentists on site to ask questions to. You can get mentorship, and you clearly have built an amazing team there. Well, thanks for sharing, Kimbra. I also use these programs, Dr. Tim, to educate. And, Kimbra is, I will call you affected or infected by dentistry, but you're not a dentist, right? You have to do so many different things, but you do not have a hygiene patient while class two's composites going on, while someone's asking you a question. You're managing this circus. But Dr. Tim, when did you graduate from dental school?
I graduated Baylor in 1987, so a few years ago.
1987. I graduated in 2002. And
Yep.
I think what they don't tell dental students enough, and I'm someone who grew up in my father's practice, and I was a dental assistant, and I worked at the front desk, and I did these things. But until I was a dentist, I just didn't realize how stressful it could be to be asked to do three things at the exact same time. So whether I want to take you back to maybe when you hired your first associate dentist, if some practice owner was watching and just thinking, I might want to hire an associate dentist, what do you think one of the best parts of having an associate is in your life?
There's, as someone who practiced solo for, gosh, the first at least 15 years of my career, maybe 20 years of my career, I would never want to go back. The camaraderie is huge. The ability to take a vacation is really, really nice. Have a little emergency coverage. Practicing in a small group practice like we have is takes a lot of stress off of you, and it's an amazing way to be a dentist. And being solo is very stressful.
I'm with you. For people don't realize this about my dental career as much. We own two offices, but we own one small satellite location where we just did crowns, fillings, and hygiene. That was it. And when I ran that practice by myself on Thursdays, it was some of the most stressful days of my week because you have to answer all the questions, deal with all the emergencies. And Kimbra, if you were talking to associate dentist and it's like they just don't have the context of what the real world feels like, you're running this team, managing this team, helping this team. What are some of the benefits to an associate dentist in your mind and being in a place with other dentists, whether that's mentorship, whether that's having to get out a tough tooth, whether that's Mrs. Jones is yelling she doesn't want a crown and you go, that's just how Mrs. Jones is, don't take it personally. Tell us about that from your angle.
Well, from our angle, that of course we're always going to have those patients that the doctors have to deal with, but they can bounce it off other doctors there. And an associate dentist in our practice, again, with the support that we have, and what we're looking for, and what our dentists do very well, is that they have a role to play. And Dr. Huckabee has set this up in such a way where we all have a role to play. So as long as we all are playing our own roles and doing that effectively, it takes off so much pressure off that associate dentist or any dentist that's in our practice and any team member that's in our practice, because everyone just knows exactly what they are to do. We are very systemized, so that again, those unnecessary stressors that are often a factor, it takes that off their shoulders so that they can effectively deal with some of just the regular stressors in the dental offices that we won't say are patients, but we have great patients too.
I love that. And I think, you said something like, Tim, that made me think of something, and I've used this many times, like dental assistants at the office, they have other dental assistants to celebrate and complain to. And front desk team members have people to celebrate and complain to. And hygienists have people to celebrate and complain to. When you're a solo dentist, it's just you, right? Whether you want to celebrate an amazing implant crown, your team can support you. And I think it's great when you have the ability to share your authentic experiences with someone going through the exact same thing as you, and that's a dentist. Now,
Yep.
as we kind of continue here in the details, you're looking for an associate dentist to join your team 4 days a week. There's great
Yep.
compensation. Tell us about the procedures. What do you want this associate to be able to do? Let's do with must do's and nice to do's, right? And even if this is hygiene checks and a night guard, and the nice to do might be endo, but I'm not speaking. You tell us what you would like the associate to be able to do procedure wise, and maybe some nice to do's. Kimbra or Dr. Tim?
I'll handle that one. So we're in a very affluent area, and I consider us a high-end restorative practice. So what you're going to be doing in the practice is you're going to be doing restorative dentistry. You're going to be doing fillings, inlays, crowns, veneers, a lot of implant restorations. Because we have our own oral surgeon, the surgical aspect is covered. Occasionally, I'll have an associate come in and say, I really want to learn to place dental implants. Well, we have a board certified oral surgeon, so you will not be placing implants in our office. But you're going to be doing Invisalign. You're going to be doing a lot, and you're going to be doing a lot of hygiene checks too. We have 10 hygienists every single day. So you're going to get a lot of shots on goal as far as patients that need dentistry. One of my things is I like to do things quickly, predictably, and beautifully. And I want to find someone who is quick, predictable, and does beautiful work, and also has a real passion for dentistry. Some of my dentists are nerds like I do, and they really like to get into the nuts and bolts of what we're doing, and that makes our job more fun. We do a little bit of limited endo, but it's mostly restorative practice.
Gotcha. Restorative gym practice. We have implant placing specialists in our practice. It's awesome because you know what I think people hate more than the dentist. Okay, I don't know why they feel comfortable telling us they hate us to our faces. I'm not sure why, but we've chosen this life, right? But I found that what they dislike more than coming to the dentist is having to leave to go to another dentist. And I want to frame this in a responsible way. We do not take out impacted wisdom teeth in our practice, but you clearly do, right?
Yes.
You, it sounds like you do limited endo, but I'm guessing Kimbra and Tim, you also refer endo in your.
Yes.
But when
We have an endodontist that's literally a block away that does fantastic endodontics, and it's pretty seamless. And we have a relationship with them where we can literally get our patient in that day if they have an
so
emergency.
you're doing both. You're doing a traditional referral model with endo, and you're
Yep.
doing a in-house model with implants. And I think it's really fun for associate dentists, especially with implants, to see start to finish cases, to be able to work and see these amazing cases being done. And I'm with you on that because there's so many cool things with implant cases and focusing on restoring them first before placing. I
Yep.
think is a great goal. Well, I want to share with our audience. People can text Southlake to 215-798-9897 to apply and learn more about this awesome position. They can go to dentistjobconnect.com. But before we wrap up, Kimbra, any last words, any other messages you'd like to share with our Dentist Job Connect audience about the practice, about what you're looking for, about how to connect with you? The floor is yours.
Um, of course, connect with you've got my email here listed. Again, you can text here on the number above, as well as reach out and submit your application on Dentist Job Connect. And we're just looking for just kind of similar people as we are. Just humble and ready to learn. I feel like our practice and Dr. Huckabee has certainly postured himself. And so it starts at the head of our entire team of just being humble enough to know that and hungry enough to just be learning at all times. And that's what we're here to learn. So we just want someone to come right alongside us and learn and treat patients in the best way that possible.
Awesome. Well, I love what you guys are sharing. Love seeing you guys. Thank you so much for supporting Dentist Job Connect and being my dentisting friend. Appreciate you sharing with us today.
Paul, always great to see you. Thank you so much for your time today.